We begin with an urgent health alert tonight. The first confirmed case of measles in 9 years has been identified in Spokane County. Good evening and thank you for joining us for KREM 2 News at 5. I'm Mark Hanrahan.
And I'm Whitney Ward. It appears that person was living in the Deer Park area. Tonight, health officials are looking for anyone who may have come into contact with that person. So we know that person had recently returned from out of the country and also known to be at several places around Deer Park from last Sunday through Thursday.
So take a look. Here is where they were known to have been: the Spokane International Airport, the Deer Park Library, Rosie's Hot Shots in Deer Park, the Taco Bell in Deer Park, Creekside Kempo Karate and Horizon Credit Union. And you can see all the dates and times of possible exposure right there on your screen. It is important to note the virus can stay in the air for up to 2 hours after the infected person has left. So if you were at those locations at the times listed above and are not vaccinated against the measles, the most likely time you'd become sick is between February 18th and March 8th.
So here are some of the symptoms that you would want to watch out for: high fever, cough, runny nose, red eyes, and a rash. If you believe that you may have been exposed and have those symptoms, you should contact your doctor right away. The Spokane Regional Health District says with this outbreak, they do expect to see additional cases reported. And the Spokane Regional Health District says the risk to the general public is low, especially if you are vaccinated.
In an effort to bring you more to every story, KREM 2's Shannon Mowdy is diving into vaccination rates and who is most at risk. Shannon?
Well, the U.S. declared measles eliminated in the year 2000, but over recent years, we have seen more cases crop up across the country, including here in Washington. Health experts say that's because of lower immunization rates. Spokane Regional Health District confirms this is the first measles case in Spokane County since 2015, when 2 people from the same home were infected.
I think we're hopeful for something similar.
Mark Springer with SRHD says the risk to most people is low, especially those who are vaccinated, though immunization rates, specifically among young children, has trended down statewide.
It is always a concern in a setting with high community immunity or herd immunity, that's above 90% or above 95%. Transmission, tends to peter out a little bit.
Washington Department of Health data shows among kindergartners, immunization rates have declined after 2020's 5-year high. Last school year, only around 87% of kindergartners had completed all required vaccinations, which includes the MMR shot.
There are very few allowed exemptions for the measles vaccine.
Dr. Sarah DeHolst says that's due to state law enacted in 2019. It bars families from claiming personal or philosophical exemptions for the MMR vaccine. That was also the year the state saw its largest measles outbreak in nearly 3 decades, with 90 cases. Washington Department of Health graphs show a huge drop in personal exemptions from 2019 to the next school year, but a huge jump in religious exemptions in the same period.
Although our overall kindergarten vaccination rates might be a little bit low, our MMR tends to stay pretty hot.
In Spokane County, just under 83% of kindergartners have completed all vaccinations. Specifically looking at measles, 91% of kindergartners statewide have gotten the shot, but that number hovers around 87% in Spokane County. Now, if you are unvaccinated and think you've been exposed to measles, Dr. DeHolst says you can still get an MMR shot within a couple days of exposure, which can help prevent infection. For those who aren't eligible for the shot, there is the possibility to get an immune globulin within 6 days. Shannon Mowdy, KREM 2 News.